Tuberculosis outbreak in Kansas has now left 2 people dead and more than 60 others infected.
It's being called the largest TB outbreak in U.S. history. But should we be worried here in Western Mass? We took our questions to a local doctor to find out.
Public health officials in Kansas City are sounding the alarm about a tuberculosis outbreak. 2 people have died and at least 67 others have been infected, according to the Department of Health. And authorities say there are most likely dozens more who have the inactive TB. Tuberculosis is one of the world's leading infectious disease killers. It's spread in the air from person to person.
TB spreads through the air, when a person with active TB coughs or speaks or sings, and patient in close contact, because it can linger in the air for quite some time. It can be really infectious.
And once those germs are in the air, they can last for hours. While the disease has been declining since the early 90s, those rates have been climbing since 2021, surpassing pre-pandemic levels in 2023. Health experts urging people to look out for symptoms including a cough lasting over 3 weeks, coughing up blood, fever, fatigue, or even weight loss.
The risk to the general public is low for TB, and if someone is having symptoms of pneumonia, regardless, I think the best way is to contact the healthcare provider so it can be properly assessed.
Tuberculosis can be a serious illness, especially for those with other health issues. But Dr. Paez tells us most people do not need to be overly concerned.
It's a treatable infection, so that's a good news. However, there are also reports of drug resistance.
There are several treatment options that typically last over a course of months. Locally, doctors infrequently see patients with tuberculosis, but Baystate does have a clinic to treat people with either active or inactive infections.
There is a vaccine for tuberculosis. However, the CDC says it is not generally used in the United States, and they say it's typically given to infants and small children in countries where TB is common.